So it's my great honor and privilege to have all of you here. And we have two distinguished speakers today. This program, this webinar is being jointly organized by Pushpanjali Trust, which is a charitable trust which has been working for the last 4 years in North India in the area of mental health and disability, and Citizens for Inclusive Living. Citizens for Inclusive Living is a relatively newer group. It's about 1.5 years old. And the idea behind this group is that it's actually a mass movement. The reason for forming this group was that why should only persons with mental illness and their families talk about mental illness and their rights all the time? It is something that affects all of society. We have a new Mental Health Care Act. It's the new law. So unless government, the civil society, students, general public, unless they are sensitized and they kind of become part of the movement, I don't think we will have a change in the societal attitudes or behavior. So that was the reason why we formed this group, Citizens for Inclusive Living. And we rallied around a common cause. Our common cause was to campaign for long-term assisted living facilities for persons with mental disabilities. That just became our rallying cry. And that's how we formed this group. It started with a few 20, 30 individuals, and now we've grown to over 150 individuals. So it is heartening to see that several students, social workers, of course, persons with mental disabilities and their caregivers, but also students, social workers, journalists are part of this. So it is growing, and we are now formalizing it. And so it's a great pleasure that Pushpanjali Trust and Citizens for Inclusive Living are hosting this program. About twice a year, particularly the World Schizophrenia Day and the World Mental Health Day, is when we try and organize some mass outreach program and we invite distinguished speakers. Last year, we had invited Dr. Kulhada, the former head of the department PGI, for this particular day. Then on the World Mental Health Day, we had Dr. Suresh Badamat from Nimhans and Dr. Anirudh Kala from Ludhiana. And this year, we are very privileged to host Dr. Sandeep Grover, who is a professor of psychiatry in PGI, and Mr. Amrit Bakhshy, who is a caregiver and writer from Pune. So I'm very happy that we are hosting this event. I would now request Dr. Simmi Waraich to introduce our first speaker, Dr. Sandeep Grover.
Thank you so much, Aditya. Dr. Sandeep Grover is a very well-known psychiatrist all over India. He is currently a professor of psychiatry in PGI in Tri-City Psychiatric Association, which is an association based in Chandigarh, Panchkula and Mohali. In addition, he's also got a very long schedule. He keeps long working hours. And he's always, what I really appreciate is that he's always available for people like us whenever we need to contact him or associate with him regarding any patient who may need some treatment in PGI, or even as far as any advice, as Aditya will agree, regarding how can more facilities be made available for people with mental illnesses, and what steps could be taken. So he's always there to kind of lend a hand, and I don't know how he does it because he has grueling hours. And I'm so glad he's here today to address everyone. Thank you so much, Dr. Sandeep. Please carry on with your talk.
Good evening, everyone. Is my screen visible?
Yes.
Yeah. So in the first part of the talk, I am going to discuss what is schizophrenia. And I would like to thank Dr. Aditya and Dr. Simmi for inviting me for this day, because this World Schizophrenia Day is an important aspect in when we try to make more and more people aware about the schizophrenia. So let's try to understand what is schizophrenia. So when we talk about mental illnesses, all of you would have heard about different mental illnesses in the media or would have read about it. So we all understand that depression and various anxiety disorders are very, very common mental disorders, and those are highly prevalent in our society. Among the other things, what we have is schizophrenia, which is although not as prevalent as depression and anxiety disorders, but the most important factor which we need to remember that it is an illness which has a significant impact on the person who suffers from it. So when we look at schizophrenia, what we need to understand, the first point we need to understand, it's a brain disorder. When I say brain disorder, what I just want to emphasize that many people in the society believe that it could be due to jadoo tona or something else, or it could be due to witchcraft and other things. Let's very simply understand, like any other disease, it is also a disease of the brain where there is changes in the brain neurochemistry and the brain structure, which leads to the symptoms of schizophrenia. I think this is something which we all need to first understand, rather than blaming the person who is suffering from illness or their family members. It's nobody else's fault. We need to understand it's a brain disease, and more we are getting to understand about the brain abnormalities associated with schizophrenia. How common it is? It is said that about 0.5 to 1.5% from out of the 100 people suffer from schizophrenia. The average prevalence figure is about 1 in 100. So we need to understand that 1 in 100 people suffer from schizophrenia. So nobody should again feel that he's the only person who is suffering from. There are many people, others in our society, who suffer from the illness. When we look at when does it start, the most important factor which we all need to understand, that it usually starts in the second or the third decade of life, which is considered to be the most productive life of any human being, where somebody is pursuing his education or trying to make a career and those kind of things. And it usually starts earlier in the males compared to the females. And that's where we need to understand that the males will have the symptoms earlier than the females. And when we try to understand the symptoms of schizophrenia, a patient of schizophrenia can have a host of symptoms which simply can be understood as they hear voices, or they have auditory hallucinations, or they may end up seeing things which others don't see, which is understood as visual hallucination. They may feel that other people are following them, trying to harm them, which could be understood as delusions, or they can be very aggressive. They may try to harm themselves, or they may laugh themselves without any reason, or they may cry, or they may be more than happy, and they may have memory disturbance. As doctors, we understand these symptoms as something as 3 broad categories of symptoms: as positive symptoms, which includes hallucinations, delusions, and the speech problems, or we have the negative symptoms as anhedonia, avolition, or blunted affect, and the cognitive problems can be there, that the person is not able to concentrate, not able to remember, and so forth. So when we talk about the positive symptoms, basically it includes hearing voices or seeing things which others cannot see, remaining fearful or becoming suspicious about somebody trying to harm them, or somebody trying to follow them or do things against them, or that they can have other positive symptoms as somebody is making them do certain things. And the negative things, simply if we try to understand, when the person who was doing well suddenly stops interacting with people, doesn't mingle with people, or is not able to enjoy life, he or she does not show emotions as much as he was showing emotions earlier. He's not able to work like before, and not able to care for himself, so forth. So this all, or not talking too much, all these are indicative that the person is having the negative symptoms. Or the cognitive symptoms is not able to remember things, not able to concentrate on things, and not able to solve a problem which they have, or may have difficulty in understanding what others are saying. This is very, very important for everyone to understand, because we need to understand this is part and parcel of illness, and patient is no more not doing anything willfully. The people can have other symptoms like getting angry, or they may become sad. Once somebody has improved from his positive and negative symptoms, he comes to know about what he is going through. They will start feeling that they will have guilty, that they will start blaming themselves, or they may have anxiety, or they may try to go out of the house, run away from the house, and they may not be able to control themselves, may have sleeping, eating difficulties. These are all kind of symptoms a patient of schizophrenia can have. And what we need to understand, because this is something which we have problems in our clinic, that we need to understand all schizophrenia are not same. We have different types of schizophrenia now. We understand that. And different people can have different sets of symptoms of schizophrenia, and the same person can have different symptoms during the different episodes of schizophrenia. So this is very, very important for everyone to understand that symptoms can keep on changing during the course of the illness. This is again because many times family thinks that, is it because of now he's having a different set of symptoms? Is it that it is due to medication or something? It's not that. That's the disorder behaves in this way. Now we are getting to understand more and more about schizophrenia. Now we know that before, actually, normally people come to treatment when they have this hearing of voices or they have marked negative symptoms. So now we are understanding that schizophrenia occurs due to degeneration in the brain, which starts much earlier in the life. And actually the patient, before they have this so-called positive symptoms, may have cognitive symptoms or some kind of negative symptoms, which may set in much before the onset of the positive symptoms. And this becomes more important when there is a family history of schizophrenia. We consider these people as at risk of developing schizophrenia. So other people can also have the early warning signs in the form of nervousness, restlessness, anxiety, or difficulty in concentration, forgetfulness, decline in the school performance, and so forth. These again becomes important, especially in the context of if there's a family history of schizophrenia, that anybody who is showing these early signs needs to be evaluated rather than we delay the treatment, because it's important that if we want that person to improve his symptoms to remain controlled, the basic lesson is start early. So as I said, if you look at this, that we understand that when there are no symptoms, this is where the person will start developing the symptoms. And usually these are the positive symptoms, negative symptoms, and cognitive symptoms we see, and people can have different episodes in their lifetime. So this is where we need to understand that a person of schizophrenia goes through this cycle in their life, and with each episode, the symptoms, the so-called residual symptoms can keep on increasing. So some of the people may have only, let's say, a few symptoms and have one episode in their lifetime, or other people can have the one episode and the symptoms may continue. The other people can have the so-called remitting course. They can have one or two or multiple episodes, or some people can just have the non-remitting course. So we need to understand again here that every patient of schizophrenia will have a different set of symptoms. This is again very, very the different course of symptoms, because again this is very important, that when many times the patient will become will improve, but family members tend to stop medication. In all kind of schizophrenia, the doctors will decide in which patient the medication can be stopped and in which patient medication cannot be stopped. So it's always better to follow the advice and go with the model. So if you try to look at this, like somebody, because it's important to understand that if your patient improves once, and if you continue with the treatment, the person will remain in the improved state and may reach to his earlier level, maybe with small amount of deficits. But if he keeps on having the multiple episodes, the deficit would keep on increasing. That's where we all as psychiatrists or mental health professionals should understand that we should prevent the worsening of the course of schizophrenia. And that's why simple thing to understand, the illness runs a chronic course. If you start treatment early, as early as we start, that's better. And if we keep on taking the medication regularly, chances of having a relapse is lower. And if the illness comes multiple times because of stoppage of medication or some other reason, the residual symptoms are going to increase. So that is where we need to understand the illness. So what are the treatments available? Medication, or some people will do well with the therapy, or some will require ECT. So we need to discuss these treatment options with the family and the patient, and depending on the patient's need, these are followed. One of the most important things in the management of schizophrenia is addressing the issue of medication adherence. If the person keeps on taking the medication regularly, that helps the person the best. If somebody is not prepared to take medication regularly, there are injectables which are available, which can be given once in a month, or in due course of time, we may have injectables which can be given in once in 3 months. So this, as the time will come, we'll start understanding better. The data currently suggests that about 1/3 to about half of the patients of schizophrenia discontinue their medication during the course of their treatment. And this is the most important mistake which is done by people, that they stop medication without consulting the doctor. So as a psychiatrist, the most important thing which we have learned now, that we need to prevent relapse. Why we need to prevent relapse? That if person keeps on having multiple episodes, it has a negative impact on the person's brain, and it will get more and more degenerated. So that is where we need to understand that if it's not that we are emphasizing that if you continue medication without any reason, if you continue medication, your brain damage is going to reduce, and that is why further residual symptoms increase will be reduced. But if the person keeps on having episodes, gradually the residual symptoms are going to increase. So I'll just like to conclude that schizophrenia is a chronic mental disorder that usually starts in early in life and influences the most productive period of life of the sufferers. It can be treated effectively, and there is a need for regular treatment. Thank you.
Thank you so much, Dr. Sandeep. That was very concise, but it brought together all the points so clearly, and especially the points about early treatment and taking a doctor's advice. As I tell so many people that, if you're going to a cardiologist or an endocrinologist, so you let them decide. But of course, you can always discuss if you are facing side effects, if you're facing any problem, you have to discuss with your doctor, and then only you should decide whether to lower the dose, because there can be harmful effects of lowering the dose. Many times people may feel that the medication is causing them harm, but actually it may be the medication that is keeping them well, and it could be the illness which is causing certain problems, like cognitive problems may come up in schizophrenia. So sometimes people tend to blame the medication for that. That may not be the case a lot of the times. So I think it was very helpful to get these very clear-cut points from you. Now I'll ask Aditya if you can introduce our next speaker, Mr. Amrit Bakhshy.
No, thanks, Dr. Simmi. Actually, Dr. Sandeep is also going to talk about the role of caregivers. In between, he just wanted to make sure that people have understood, and in case they have certain questions. But what I feel, Dr. Sandeep, that people already are starting lots of questions, and our webinar will get derailed if we take questions now. Well, first of all, thank you so much. You like a bullet train, you've so much of information in a very concise form. That's so much of information in a very concise form, and these are questions that come again and again. And because, I mean, what you mentioned, that because every individual is different, and the way the disease plays out over the life cycle of one individual is also different, I think that sort of complicates matters. And sometimes people compare, and sometimes, we hear things like, उन्होंने medicine छोड़ दी थी और उनको कुछ नहीं हुआ, तो क्या हम भी छोड़ दें? And you've explained very well that such comparisons are not valid. It would vary from person to person, and even in the same person over the life cycle. One of the very common questions we often get, or one of the questions that every parent or every person has, is whether there will be a permanent cure or it's a lifelong treatment. And I know that psychiatrists like to compare it with diabetes and say that, it's treatable, but you need to have medication throughout your life. If you could just clarify that, Dr. Sandeep, although I know you have and Dr. Simmi has just done that, and then I would request you to continue with your second set of presentation on the role of caregivers before I introduce Mr. Amrit Bakhshy, and then we throw it open for discussion.
Okay. When we try to understand that it's treatable but not curable, we need to understand that it's a chronic illness which can be managed with the medications and other treatment modalities, but it is not curable. When I say not curable, means you cannot stop the medication. The disease will remain under control till the time you continue taking medication. As you have already pointed out, somebody will have a hypertension or diabetes. Your diabetes and hypertension will remain under control till you are taking the medication. Once you stop it, again, you will have a problem. Or more simpler to understand, it is like anybody's thirst or appetite. Till you have, keep on having food, it is fine. Once you stop having food, you're going to feel hungry. So that's where a simpler way to understand. It doesn't mean having food is an illness, or you can stop eating food. So that's a simpler thing to understand. We can treat the illness by giving medication, but these have to be continued for long. So should I go ahead with the second presentation?
Yes, please.
Okay. So I dedicate this presentation of I dedicate this presentation of mine to all the caregivers of persons with mental illness, because as far as I am concerned, I feel that we doctors do very little for the care of the people with mental illness, and this is where the most important role in the Indian setting is done by the caregivers. This is something which I will honestly acknowledge and admit. So when we look at the needs of people with mental illness, as I have already pointed out, they require long-term treatment, and long-term treatment at times involves staying in the hospital for long, getting to the daycare center, or going to emergency from time to time. And once the patient has improved, the caregivers have to focus on the skill development and the rehabilitation of the patient. We need some kind of supported employment, because in India, we do not have these kind of facilities. Yes, some disability benefits may be available in the form of housing and other things also they have to arrange for. Now, when we go talk about all this in the Western countries, government schemes are there. People will be able to get a lot of benefits, social work and other things are available. So people with mental illness are slightly in a better position than what we have in India. But in India, who does all this for the patient? I think we need to understand government does negligible. I would say nothing is done at the government level. Minimum level of services are being provided at the government level. So family takes all the responsibility of the patient, and that is where we need to understand and acknowledge their contribution to the treatment of mental illness. So what we doctors understand about our role in the about the role of the caregivers in the management of mental disorders, that is what I am going to allude to. So when we look at the role of the family members, it starts with identifying the illness, that whether their family member has a mental illness or not, or especially in patients with schizophrenia, because patients themselves may not be aware that they have a mental illness. So it's a family which identifies that person is suffering from a mental problem. They take the responsibility of bringing the patient to the hospital, and they are made part of all treatment decisions of the patient, because whatever the doctors have to decide, because the patient at times are not in that situation, the family members participate in all decision makings, and at times they have to take difficult decisions, and they also stay with the patient in the inpatient stay, and also they manage the patient at home. Can we stop this? Can everybody mute themselves? Can others mute themselves, please? There is a lot of background noise. Please mute yourself. Okay. Aditya, can you ensure that others are muted, please?
Yes, Dr. Sandeep. Just a sec. It's being done.
Yeah. So the family is also involved in the supervision of the medication of the patient, and at times they take the role of the patient in terms of performing the household work. For example, if the husband gets ill, the wife takes on the responsibility of earning or managing the workforce and other things, and they also manage the finances. They try to meet the expenses of the treatment. So all this is being done by the family, and in India, we know that about more than 90% of the treatment cost is borne by the family members, and government contribution is about 5 to 7%. And once patients improves with the medication, because the patient will have deficits, family again has to plan for their rehabilitation, because we do not have structured, organized rehabilitation services across the country. So family may have to open a small shop or go into any kind of business or anything, just to rehabilitate the patient or maybe engage the patient at home. So all this responsibility is taken care by the family. So all this is very, very stressful for the family. इसका परिवार पे बहुत बड़ा बुरा असर पड़ता है and इसकी वजह से वो परेशान रहते हैं. तो what the caregivers have to face on a day-to-day basis, that they just don't have to face the ill relative who may be either getting aggressive towards them or who may not be interacting with them, that he is lying throughout the day and they have to push the relative to do some work or do take bath or eat food or sleep on time. So they have to face all this situation. And at times, the relative who is suffering from mental illness, without understanding what he or she is going through, will become uncooperative and at times start hitting the caregivers. Then all this also is associated with further that they have to face financial difficulties. Everybody is not able to afford treatment. The treatment at times becomes costly for some of the family members. And then because you have to take care of the ill relative, there's disruption in the whole family life. For example, if a child is suffering, the parents have to decide how they want to go, if they want to go out anywhere, how they're going to organize things. They stop socializing, they stop meeting people, and they have to organize their so-called day-to-day life surrounding around the patient, that who is going to be available to do certain things from the patient in the round the clock, that is 24 hours. Then all this has a lot of negative impact on the physical and mental health of the relatives, and it's very well known that now the relatives are suffering from more and more negative physical health consequences also, and also the mental health consequences in the form of depression and physical health consequences in the form of chronic physical illnesses because of the continued stress which they face in their life. Then they have to face the society. So what society gives them is a lot of stigma, which is unfortunate in our society, but that's the fact which we need to understand. People don't try to mingle with people who or their relatives who suffer from mental illness, and people all due to this, the caregivers, everybody tries to hide the mental illness, and they just want to avoid talking about it, so they start suffering themselves. Then the stigma also lead to a lot of negative consequences in the form of that people start losing hope. They do not go for treatment. That if I go to the treatment, if I'm going to PGI, finding in a psychiatry OPD, somebody will see, if my relative comes to know, our neighbors comes to know, what is going to happen. We're going to lose status in our society. There is loss of income, and gradually there is a lot of hope, a loss of hope, and they feel that the caregivers themselves will feel that people are so-called discriminating them, and they start remaining sad, anxious, and avoid socialization. So this is what again kind of brings further stress to the caregivers. Then they also suffer from, as I said, because of the illness affects people in the very young age. Child is studying, he's an aspirant for, let's say, to take a NEET exam or JEE exam, and suddenly class 10th, 12th, he suffers from mental illness and his education gets derailed, and the so-called a child who was doing very well, parents starts feeling that what they have lost. So they then if the illness starts slightly later, somebody had qualified the education, that he's not able to work. That's a major stress again for the family members, and because it affects young people, so marriage and the marriage prospects get affected. So all this affects the caregiver in a very, very bad way. Then the caregivers worry a lot about the future in terms of whether the patient is going to respond to the treatment or not, whether if the patient responds, gets well, is illness going to come back again, and how long the medication is going to continue, what are the side effects. They are taking a decision, what if side effects occur, others are going to blame me, and what about the future generation? If a wife is caring for the husband, or husband is caring for the wife, the most common question they have, will the illness go into my next generation? Of course, finances is an issue. Then the most common thing which parents have to go through, what is going to happen once I am not there? This is because in today's world, we are having small families, or if at all we have big families, we do not have too much of interaction. They're so-called disintegrating. So the parents who are caring for their children who have suffered from schizophrenia or other mental illness, they have this question often in their mind, what is going to happen to my child once I am gone? So that again brings in a lot of stress. And if as a wife, or a husband, you're taking care of a person with schizophrenia, if you have not been told about the mental illness of the person before marriage, you at times feel cheated, and you are often emotionally dissatisfied, sexually dissatisfied. There's a lot of burden of the family which comes onto the one person rather than two persons sharing the responsibility. So you start facing too much of responsibility stress. So once we understand all this, what are the further consequences? So the consequences which happens for the caregivers is the most common thing, as I've already pointed out. They start neglecting their own health with the hope that if they do things for their wards, he or she is going to improve. So they try to do their best, and the whole life starts revolving around the patient, and they start neglecting their physical health, mental health, their so-called socialization. They forget about their hobbies, what they want to do, their aspirations, and everything is gone. Then because of the stigma, and because the person whom you're caring for is not available, there are very few people available to take care of you. As a caregiver, you start feeling lonely and detached from others. There's a lot of feeling of hopelessness, helplessness, remaining anxious throughout the day. What's going to happen next? What if he relapses? What if he gets angry? What if he shouts? And at times you sit alone, lock yourself in the room, and often cry. At times you get angry about your destiny, why you're going through all this. And because caregiving is a 24/7 job, it is very, very tiring. And at times the caregivers themselves feel that it's better to die rather than continuing this way. Then what all you end up sacrificing in this whole course, that many young caregivers who get involved with the patients of schizophrenia as a spouse or the parent, your whole life course changes. As I've said, that you cannot decide anything about what you want to do. And if the young children are caring for their parent, their career prospects will change. They will make changes in their career. Your whole lifestyle get changed, and you start losing your possessions, prized possessions in the form of maybe property or other things, just to meet the treatment. Of course, socialization, friends, and everything goes away, and you forget life as a caregiver. And what you do, you try to show affection for the patient. You try to show that you still care for him, but at times when she does not reciprocate, or he doesn't so-called respond to what you want him or her to do, you often get angry with your caregiver, your patient also. So what basically caregivers should do to cope with the caregiving stress, this is something which we need to understand. First, try to recognize that you are under stress. This is something very, very important for every caregiver, because nobody can say that he is not under stress when you're caring for somebody else. And you need to identify your symptoms of stress, which may be just feeling tired, headache, body aches, or having anxiety, or not able to sleep. You're having so-called stiffness of your muscles or body, or at times you feel sad, irritable, or you're not able to concentrate on things which you want to do, like reading a book or watching TV or doing things when you're feeling lonely, or you start using substance to take care of your stress, that you start smoking or taking alcohol. All these are actually signs of stress, and which can give you some idea that you're going through stress. And the most important thing, when you, as I've said, if you're feeling tired and if you're feeling tense, I think you require evaluation for depression for yourself. And what are the early warning signs that you are getting stressed as a caregiver? When you stop interacting, you lose interest in your hobbies, you start feeling sad, irritable, you start losing weight, you're not able to sleep in a proper time, and at times you are suffering from a physical illness and you're getting ill time and again, that you're suffering from simple infection, or you're developing frequent respiratory tract infection, or those kind of things. All this will indicate that you're going through stress. Then this is where, as a caregiver, you should always ask this question to yourself every day and day in and out, that I'm getting easily agitated with those I love, especially the person whom I'm caring for. Am I becoming more critical of others? That's where you'll realize that once you start becoming more critical of others, there's some amount of stress which is running behind. And am I having difficulty in laughing or having fun, or am I turning down most of the invitations from others? If you're getting answer to all these questions, you have stress. And as am I feeling depressed, or feeling hurt, or I'm resentful, or I feel trapped in the responsibility which has been given to me? you need to keep on asking these questions to yourself. And at times caregivers will feel that I'm being manipulated, that the patient is not understanding me. And so all these questions, if they are giving you some kind of indication that the answer is yes, you should get yourself evaluated. And what you should do to avoid this kind of stress. I think this is very, very important to understand, that the most important thing is avoid getting angry. And what you need to do is you have to stop trying to control everything in your life. Or if the patient is not agreeing to you, don't try to get too much involved and try to push him every time to do things, because more and more you do, more and more you may get frustrated. Don't spend all the time with the patient. Maybe having spending some time off the patient may actually give you some amount of happiness, and try to pursue your own life, that try to pursue some of your own goals, hobbies, and also try to relax alone. And should avoid taking all the responsibility of the person. If you have other family members to share the responsibility, always try to share the responsibility. That's going to help. And don't try to, again, cut down independence of the patient. More and more you try to cut down the independence of the patient, more and more he or she is going to get agitated with you, and you are going to have problems. And don't try to, again, change all your priorities of life when you're caring for the patient. Try to maintain your priorities of life, and don't try to neglect the patient's need. If patient has certain needs, try to look into that, whatever you can do, and have proper effective communication rather than having ineffective communication. When I say ineffective communication, means you're talking to the patient by in a loud tone, or a tone which the patient does not like. And always be in touch with the treating team. Don't try to cut off that you think that doctors have started medication, doctors have told the patient has to take medication for long, so why should I now keep on going to the doctor? It's just a waste of your money. It's not that. Going to the doctor often helps, makes you understand things, and also the doctor is also going to take care of you as a caregiver. And never decide about stopping treatment, changing treatment on your own. Many times caregivers will try to increase the dose or decrease the dose on their own, which is to be avoided. Don't blame yourself for whatever is happening around, and it's not your fault. It's something which nobody can change it. So it's better stop blaming yourself. Avoid using any kind of substance, because it is actually going to increase the stress of yours, and also actually have a detrimental effect on the patient. So what should be your approach? The approach should be that you should learn to take care of yourself. Once you learn to take care of yourself, you are going to take care of others. It's like when you're flying in the aeroplane, the air hostess will tell you that if there's an emergency, first use a face mask for yourself and then try to help others. That's something which you need to understand, and always take out some time for yourself. And being kind to self does not mean that you are selfish, and you should always learn to take care of yourself, and just try to do your best for the patient. And remember that you cannot do everything for your patient. Then always remember to stay in present rather than planning too much for future. Try to stay on the day where you are where the situation is, rather than worrying too much about the future and increasing your stress. Then this is important to again understand that that your patient may have a lot of symptoms and things. So what you need to do is maintain your patience. If patient abuses you, tells you, blames you for anything, please understand it is because of the illness. Patient does not really mean what he is saying, because once the patient gets well, you will realize that he does actually never meant that. And always avoid any kind of stressful situation. Try to laugh over things which are happening around, and try to talk to other family members or the other caregivers. Once you visit to the hospital, or when you're visiting the doctor, or any caregiver groups are there, try to be in touch with them. You will understand that it helps. And always have a so-called positive approach to your life, and start whenever you're talking to the patient, always pass on the message very clearly to the patient, and try to stick to the things which you want to tell, rather than again changing. And try to get the attention of the patient when he's in a mood to talk about, rather than when what you want to talk to him. And always ask simple answerable questions to a patient rather than asking too difficult questions, and listen to the person with your eyes, ears, and heart open, so that any small thing, patient may not always tell what he wants to say, but he can communicate you through different methods. And whenever the things are getting tough, try to distract yourself and redirect, and respond to with affection and reassurance, and remember that they were good old days, and it's possible that you will have future which is going to be good, and maintain your sense of humor. Thank you. I'd like to stop here.
Thank you so much, Dr. Sandeep. Actually, I'm already thinking that either of these two presentations deserve a webinar in itself. I'm sure we already have many questions around schizophrenia and the treatment and the prognosis. And then lots of questions about your second part of the presentation, the stress of caregivers and what they can do about it. And there are already lots of questions in the chat box. I think, Dr. Simmi, we need to organize these webinars more often, maybe once a month or once every 2 months, and sort of concentrate on one topic. Because in a way, if the participants are not able to ask questions in this, and we also have this limitation of time. So, but thank you so much, Dr. Sandeep. Wealth of information shared. I have to share a personal experience with Dr. Sandeep 3 years ago when I first met him. I was collecting a list of signatures of persons who needed long-term assisted living facilities. And I was running around the city getting signatures from the parents' guardians. Dr. Kulhara asked me to meet Dr. Sandeep. Dr. Sandeep sat me down in his office and he said, despite his busy schedule, he politely said that, why are you running around the city like a headless chicken? Many parents will, because of stigma or other things, may not sign on the document. So why don't you conduct a survey among psychiatrists, that what is the need, because then even the hidden need will come out. What is the need for different kinds of facilities, daycare centers, halfway homes, long-term group homes. He not only suggested that, he also helped me design the survey, and in his very efficient way, despite his 12-hour, 14-hour long work schedules. So Dr. Sandeep, thank you so much. Very, very grateful. It has also been pointed to me that I haven't.
Yeah.
It has also been pointed to me that I haven't introduced the team. My bad. Citizens for Inclusive Living, we have Neelu Sareen here with us. Neelu Sareen is a special educator and area director, Special Olympics. She's our president. We are also very fortunate that Dr. Simmi Waraich is our vice president. She is what I call the sweetest psychiatrist on planet Earth, always available for friends and people. Gurpreet Singh is our psychiatric social worker. Anupinder Kaur is a clinical psychologist, currently on leave in Lucknow, but she's still here co-hosting this session, helping us out. I am currently the managing trustee of Pushpanjali Trust. I am also a part of Citizens for Inclusive Living. I should have done this introduction earlier. My bad. Sorry, I forgot. We'll now move on to our second speaker, Mr. Amrit Bakhshy. Mr. Amrit Bakhshy is quite a legend now. He's actually a career banker who, because of his adult daughter with schizophrenia, took premature retirement, packed his bags from Bombay or Thane, I am forgetting where exactly, and moved to Pune and joined this organization called Schizophrenia Awareness Association, later became the president of that, and now he's the former president. He's since retired. He's 80 plus, but extremely active on Twitter. All those who are on Twitter must follow him. Extremely educative posts. Mr. Amrit Bakhshy is also a writer. He has written several books and several articles trying to demystify the Mental Health Care Act, make it accessible to caregivers and the general public. He was part of the expert committee appointed by the Government of India to draft the rules and regulations for the Mental Health Care Act. Recently, Reader's Digest did an article on him, and Mr. Bakhshy lovingly himself calls him Uncle Agony. He's always available to parents and guardians to listen to their travails and try and help them out, offer them advice. Amrit Bakhshy, it's a privilege to host you. Over to you.
Yeah, thank you, Aditya. Professor Grover, very simple language have explained what the schizophrenia is, and then in his second part of his talk, he has talked everything that one can say about the caregiver's role. Very, very comprehensive presentation, and I think you must circulate his presentation amongst caregivers. It is a complete thing that one can talk about caregivers, and the entire canvas has been covered by him beautifully. Now, only thing is that Aditya has the topic which he has given. I think we can go to the slides. There is quite a bit of repetition. What he gave me in the first part that related to caregivers and users. So what I will do that I will skip the caregivers part so that there is no repetition, and the other part I will cover. हाँ जी गुरप्रीत जी जरा शुरू करो the slide.
Yes, sir. Just 1 minute, sir. Please go ahead.
हाँ जी एक मिनट how to remove this one now. I think you have to give me full screen. नहीं पहला put the first slide only.
Yes, sir.
I will tell you when to change the slide.
Sure, sir.
Yeah, then minimize करो. So I was given two topics to speak on. One is challenges and sufferings of patients and families, and the other was the role and responsibilities of community and state. What Aditya had suggested that if I am doing slides, 5 to 6 slides should be enough, but these are very vast subjects, as he was talking that caregiver's role needs a full session. So these two topics also need full sessions, but I have tried to condense them in 10 slides. The first and last slide, they are just ornamental. So actually there are only 8 slides. So we will take the first topic. Haji, Gurupreet ji, next. Please show the next.
Yes, sir. It's just taking some time.
Okay.
There's some technical issue, I think.
अच्छा अच्छा शायद मेरे को होस्ट कर लेना चाहिए था अपने को, लेकिन मैं इतना कंप्यूटर सावी नहीं हूँ, इसलिए मैंने कहा कि perhaps you can handle it better. So हाँ जी, तो challenge and suffering of patient, this I will cover because this was not covered by Professor Grover. So you see the suffering of the patient is very severe. If the symptoms are severe, then the suffering is more. If the symptoms are mild, then the suffering is less. And as Professor Grover told us, the caregiver suffering is as much as that of patient. And what happens is that this suffering is invisible. You see, if there is a fever, if there is a cough and cold, if there is some injury, then it is seen. And if someone has cancer, then also pathological tests will reveal that there is cancer. But this schizophrenia or related mental disorders, it is not visible. So when the symptoms start, the family generally thinks that this family member is pretending, he is very lazy, he doesn't want to go to the college and do the studies, or doesn't want to look for a job. So invariably the patient is blamed, and much later it is realized due to lack of awareness that he has this very serious mental illness. Now, when the symptoms become severe, then of course the behavior of the family member with mental illness is it creates lots of problems. If the relatives come, he may abuse them, he may tell them to go away. So relatives stop coming, friends stop meeting him. So he becomes a lonely figure. And he doesn't have insight. He doesn't know what illness is. He does not accept that he is ill. And if the hallucinations or delusions that he gets, he thinks that those are real. Family members do not hear the voices. Family members do not see those pictures, those images. So they say that what our family member is talking nonsense. And then he has to suffer. When the treatment starts, then he has to suffer the side effects. The side effects can be very serious. There can be tremors in hand, although now second generation, third generation medicines are there, but still symptoms happen. Weight gain is a common symptom. Drooling is a common symptom. And unfortunately, in some cases, lactation can happen. A male patient may have lactation. Some unmarried girls may have lactation, which creates a lot of embarrassing. And then the suicidal thoughts come, patient becomes very aggressive, and I can't see this anyway. So when there is a lucid period, or when there is some remission, then the frustration builds in, because those who were his classmates, they have passed out, they have got the jobs, whereas he is just sitting at home doing nothing. So a lot of frustration comes. So these in short are the sufferings of a patient, and these challenges are more for the caregiver and less for the patient, because patient doesn't realize that it is his illness which he is going through. So it is the family caregivers who have to accept the challenges, try to give the treatment, and so many other things which I will not cover now. Gurpreet ji, you can leave the slide number 3, 4, 5.
Yes, sir. I'm trying to change the slide, but it's just taking some.
Yes, yes. We will take the next subject, that is the role of community and state, because those are not covered, so I can speak on that. Ithiye.
So you can continue.
So the second part of my presentation is what is the role of and the responsibility of community. Now, community doesn't have much of a role. I mean, they hardly play there any role. But if they have to take the role and responsibility, then they have to promote awareness. You see, the lack of awareness is the main culprit. So that kind of webinar we are having, they have to organize such webinars, they have to arrange meetings, they have to, the peer support groups they have to form. So they must talk about the illness. That is the best way to remove stigma, and that is the best way to create awareness, talk about the illness. So that community should do. And now they should treat the persons with the schizophrenia and related illness as equals. They should not try to remain away from them, not mix up with them, and not refuse to mix up with them. And if there is any problem, if the person with mental illness does not behave properly, then they should understand that this is not the illness. This is the this is not his fault. It is the fault of his illness. So that understanding must come in the community. And then this promotion of community homes, etc. I think this will come in discussion. That was a separate a topic which was listed about this rehabilitation. So that rehabilitation is important, and that is also a separate subject, how to rehabilitate those people. Maybe we'll speak in question and answer form on that. You see, it is very necessary that we should have residential rehab centers. We have residential rehab centers, but they are all run on commercial basis. They cost quite a lot. Even for a dormitory type accommodation, the minimum cost is 30,000, which lower middle class people cannot afford. So there the community can come forward. You see, your NGO in Chandigarh, I think Parivartan is the name. They have done a very good job by keeping a bus and going to the homes of the patients and helping the families. And if the need be, bring the patient to the hospital. So similarly, they should also run a day rehab center, because when the patient comes to a day rehab center, the patient is not segregated from the community. Patient goes to home in the evenings, and daytime patient spends in a day rehab center where the patient is kept busy in a lot many therapeutic activities, so which helps the patient. If patient takes the medicine regularly and patient also keeps coming to the day rehab center, then there is a lot of benefit. And if the illness is severe, symptoms are very high, then residential rehab center is good for the patient. So there is a lot of need to run residential rehab centers on a no profit, no loss basis. If 30,000 is the cost for a rehab center, residential rehab center, which is run on a commercial basis, then no profit, no loss basis, it can be run, and the charges can come down by 50%. So that is what community should think about it, and the group of caregivers should think about running it. Then you see, it has to be integrated care and treatment. We should not open more mental hospitals, and those multi-specialty hospitals as we have, there we should have psychiatry wards, inpatient, outpatient, so that they are not segregated from the community, they are not segregated from the medical facilities. They should get the same medical facilities which patients with the physical illness are getting. So that is very important, that we should have psychiatry wards in medical colleges. We should have psychiatry wards in multi-specialty hospitals. Next slide, please. Slide number 7. So you see, the state has a very important role to play. Unfortunately, they are doing nothing. So I am only covering the role which they have, which is cast upon them by the Mental Health Care Act. So if they just comply with the role which is given to them legally under the Act, then that will be a great service to the persons with mental illness and their families. So what the Act says, that the state must provide treatment which is affordable, good quality, in sufficient quantity, available nearby, and without any discrimination. So nothing has been done by the state so far. The Mental Health Care Act was notified by some 4 years back. In these 4 years, hardly any action has been taken, or hardly any facility has been provided. Then outpatient and inpatient services should be there, that I have already talked about. And it should be a part of general health service, that also I have covered. Slide number 8, please. Now, there is a provision that the reimbursement of the cost of treatment should be given if in that district there is no facility, mental health facility provided by the government. So in rules, it has been explained further that the reimbursement, in what manner it will be given. So that has to be done by the government. I don't think so far any such reimbursement has been given by the government. Then the people below poverty line, destitute, homeless, they have to be given free treatment without charging them anything. Then essential drugs have to be given free to everybody. So that is a very big facility if it is extended, if it is given. So that government has to do it. Unfortunately, central government, state government, both are not doing anything in this regard. Then the quality of service, see, there should be no discrimination in the quality of service. The same quality as it is for physical illness should be given to the persons with mental illness. Then budgetary provisions have to be made. No budgetary provisions have been made so far in the budget, especially towards the implementation of the Act. Now this telemedicine, some announcement was made by the Finance Committee, and for that, that one advisory committee and some subcommittees have been formed, and they seem to be quite keen on doing something what has been announced by the Finance Minister. I am also on one of the subcommittees. Few meetings have taken place. So I think something will happen soon in regard to telemedicine. That scheme is called Telemanas. You may find some information on this internet. Otherwise, I will tweet some information. So this is my presentation. I did not cover this caregivers slides, but in question answer, if there is anything which you can ask me. Now, normally the last slide is thank you. So instead of that thank you, I have got a slide with a poem that shows the anguish of the parents. I will just read it quickly. My boy with schizophrenia, they don't touch him, but stare at him instead, like he has a sickness that is going to spread. He is not contagious. He doesn't have COVID-19. He has an illness which is a bit frightening. His genes are corrupted and his brain erratic, genetic proneness, environment traumatic. Schizophrenia is a bane. It's going to destroy all that he worked for since the time he was a boy. Thank you very much.
Thank you so much, Mr. Bakhshy, especially the last poem. We shall now open it up for questions. I would also like to acknowledge. Yes. I forgot to acknowledge in the beginning, in the audience among the participants, we also have the stalwart Dr. Kalyan Sundaram. Dr. Kalyan Sundaram is the pillar behind Richmond Fellowship Society in Bangalore, since there's been a reference to halfway homes and long-term group homes. And this is what we've been passionately campaigning for in Chandigarh, with some success now. And I always tell people, anyone who's going to Bangalore or anyone, that please visit Richmond Fellowship Society, because Dr. Kalyan Sundaram has, what I say is, set the gold standard for halfway homes and long-term group homes. So Dr. KS, very privileged to have you here among the participants, and we will surely have you in some of our future webinars. I will now open it up for questions. We already have some in the chat box. May I request Dr. Simmi, Anup, and Gurpreet to coordinate? How do we open it up? Maybe
Yeah, I've been through the question. Yes, Aditya, I've been through the questions. So some of the questions are regarding therapy. For example, someone has asked, what are the indications for ECT, and does Rtms also help?
Okay.
Dr. Sandeep, would you like to answer?
Yeah. So what we need to understand that ECT is usually not the first line treatment. It is usually used in patients who are not responding to the medications, but at times when the patient is severely, who is having schizophrenia, but is also depressed or is suicidal, or is refusing to eat food, or is he very, very aggressive, agitated, or threatening to harm others, in those situations, ECT may be used. But usually ECT otherwise is used in patients who are not adequately responding to the pharmacotherapy. Now, regarding the Rtms, yes, some data is emerging over the years, Rtms and TDCS, that some people who are not responding to the medications do respond to this treatment, but this has to be continued. Once we stop this, many patients also report relapse of symptoms. So it is not that with Rtms and TDCS, the symptoms are going to go forever. So that needs to be remembered.
Thank you, Dr. Sandeep. Another question that was asked was that, can I change my doctor? Do the symptoms, if they are remaining the same, do we change the medication? If we change the medication, then sometimes the symptoms still remain the same and they don't go away. They become like chronic symptoms which don't respond to medication. So in these cases, what can be done?
As I say, that the most important thing to understand that if somebody wants to change his or her doctor, I think he or she is in full liberty to decide that. There is no bar on that. And in India, where we are living in a country where there is something like, you know, visit to a government doctor, go to a private doctor, anywhere. It's not like a Western country where you have to go to the GP, then he will refer you to the specialist. So we are very, very privileged. So anybody wants to change a doctor, he or she can do it. The other question about chronic symptom responding, not responding to medication, I think it will totally depend on what kind of medication the patient is getting and whether what is the level of treatment resistance. If patient who has a treatment resistant schizophrenia, which as psychiatrists we understand that patient has not responded to good trials of antipsychotics, then patient is being considered for clozapine or not. So if your patient is not on clozapine, you should always try to go and discuss with your doctor whether he's a patient who may require clozapine. Clozapine has slightly more side effects than other medication. but it definitely works in patients who do not respond to the other medication. And there are, but also we need to understand about 1/3 to about 2/3 of the patient may not respond to clozapine. So in that situation, we have less of options of medication. In that, doing psychosocial rehabilitation, addressing other issues often add on to the treatment. So there we need to understand that not necessarily that all symptoms are going to go away. And that's why I emphasize that rather than reaching to that stage as illness becomes chronic and patient does not respond, because that always happens when the patient has multiple episodes in their life. So it's better that we treat right from the beginning and maintain the medication adherence.
Thank you, Dr. Grover. Very well said that the medication, if given early, may prevent deterioration. So that is what is important. But yes, in some cases, people may not respond to medication. Another question that was asked is schizophrenia a genetic disorder? And what is the incidence of schizophrenia in North India?
Okay, we do in terms of incidence and prevalence, the data suggest about that 4 persons in 10,000. That is the incidence from the North India data, but that's a very, very old data, and we are not have much of incidence studies in recent times. The National Mental Health Survey, which also included patients from India, from the North India, the prevalence figures are about 1.4 per 100. So that's the new data for schizophrenia and psychotic illness. What was the other question, Dr. Simmi? Sorry,
Is schizophrenia a genetic disorder?
Yeah, regarding the genetics aspect of it, what we need to understand, schizophrenia is a multifactorial disorder, that multiple factors play a role in development of schizophrenia. And at present, we have not reached to that stage that we can say this particular genetic cause is responsible for schizophrenia. The two important facts to remember, that anybody who has a family history of schizophrenia not necessarily is going to develop schizophrenia. So everybody, 100% people who are with a family history are not going to develop schizophrenia. The risk will vary depending on the kind of relative who is suffering from schizophrenia. Then there are people who do not have a family history of schizophrenia can still develop schizophrenia. So genetic is one of the component, but not necessarily the only cause.
Thank you. A very important question someone asked, the Secretary General IS, someone asked is, people are often excluded from disability benefits, and disability assessment is only available at some hospitals, and patients may be scared of going to those hospitals. So they may not go to get the disability assessment done for that. So can we involve private doctors in this, or is there any other way to do this assessment?
Now the government has done it very clearly, and which is very beneficial for the patient. The disability assessment can be done in any nearest local hospital. So you don't have to come to, let's say, PGI or 32 to get your disability assessment done. If you belong to Punjab or you belong to Chandigarh, you can go to the nearest place where you can seek treatment in a, let's say, local civil hospital, and you can apply for disability. The disability applications are now also done online. So the process has been changed. So we need to understand that now you can get it done much easy way. So that there has been a progress in that.
Thank you. I'm sure that will help many people.
1 minute, madam. Some clarification will be required on this. Is there any notification or circular that a private hospital can issue a disability certificate?
No, sir. I'm not talking about the private hospital. I'm talking about the government civil hospitals.
Achha, because the question was about private hospitals.
Yeah, that's what I'm just clarifying. I'm just clarifying because what the other part of the question is, because patients are scared to go to certain hospitals. So now the patient can go to the nearest government hospital and get the disability certification done.
As far as my knowledge or my understanding is that online one can apply, but still one has to go at least once to a government hospital.
Yeah.
Because that idea scale they have to apply and they have to see that, and it has to be the government hospital of the place where you are residing, or that government hospital where you have been treated. Now, if somebody comes to PGIMER from Pune or Bombay, then they can issue the certificate. Or,
no, sir. I think, sir, that has now changed. You have to seek certification only in the place where you are staying. So anybody who's seeking treatment from PGI may not get a disability benefit who is staying in Pune from PGI, he will apply to the local place, and PGI doctors can provide the other doctor there the idea score for certification. So to make the things easier for the patient. So that's a change.
Oh, so where one person is getting treatment, he can't get a disability certificate from there.
If it doesn't, his place of residence does not fall in that particular state.
I'm not aware of this change.
Yeah.
So the only place where he has to go is to the civil hospital of the district, and in those metros where there are many government hospitals, then he can go to any of those hospitals. Is that the position?
Yes.
Okay.
Yes.
Thank you.
Thank you so
Thank
much.
you.
I would also request, we'll take Dr. Simmi, sorry, if you were going to say something, and then we will, there are two people who want to ask questions. One is Ms. Kiran Joshi and the other is Mr. D.R. Paul. But Dr. Simmi, please finish if you were continuing with something.
Yeah. No, I think most of the medical questions are done, and there were some other general questions like, why has treatment beyond antipsychotics not been found? Is there not enough research in this area? But I think Dr. Sandeep Grover can answer that.
Okay. I would just say that a lot of research is going on in the mental health area, in the area of schizophrenia. Unfortunately, whatever the molecules are being designed, they are being found as effective as the currently available molecules with some reduction in the side effects. We do not have a molecule coming as close to as the efficacy with respect to clozapine. So a lot of research is going on, but we have not been able to move beyond that. The question which we need to again understand here, that till now we have not been able to find the exact cause of schizophrenia. And because it's a multifactorial illness, you cannot target one thing. There are multiple things to be targeted. So at present, that's why, like somebody had asked in that chat box, I'd see why not something like bone marrow transplant or some transplant or this or that. That cannot happen. Schizophrenia can only be, if you want to think from that, is a brain transplant, which is not going to happen. That is not feasible, not possible. So we hope that with time, we'll have better understanding about the etiological factors which are contributing to schizophrenia, and then we may be able to target that. We may have in gene therapy in next 20, 30, 40 years to come in, we may have some changes in the treatment. So let's hope for the best. Whatever we have at this moment, let's use that effectively, because at present, whatever we have is not actually being used effectively for most of the patients.
Thank you, Dr. Grover.
Yeah.
Aditya, you would like to take on?
Gurpreet, maybe Mr. D.R. Paul can ask first, and then Ms. Kiran Joshi. These are the two people, who had.
नमस्कार, मेरा नाम D.R. पॉल है. मेरी वाइफ है, शी इज सफरिंग फ्रॉम स्किज़ोफ्रेनिया, बाइपोलर मैनिक टाइप. बिगिनिंग में जो डॉक्टर संदीप ग्रोवर जी ने सिम्टम्स बताए हैं, वो सारे ही सिम्टम्स मेरी वाइफ में है, लाइक एंजाइटी, सैडनेस, हाइपर एक्टिविटी, स्लो मूवमेंट, सेल्फ वीपिंग, सेल्फ लाफिंग, सेल्फ सिंगिंग, reading irrelevant topics, no sleep, and erratic behavior, changing behavior frequently in a day. तो ये सारे सिम्टम्स उसमें है. मेरे हिसाब से ये डिजीज नॉट क्योरेबल है, और 95% इसमें रोल केयर गिवर का लगता है मुझे, और 5% मेडिकेशन का हो सकता है. तो मेरा क्वेश्चन सिर्फ 5% के लिए है कि डॉक्टर्स जो मेडिसिन देते हैं वो, आई एम सॉरी टू से, हिट एंड ट्रायल करते हैं. जो केयर गिवर है वो जो फीडबैक देते हैं उसके बेसिस पे मेडिकेशन कम ज़्यादा करते हैं. क्वेश्चन इज कि क्या कोई मेजरमेंट्स, कोई लेवल ऐसा है, जैसे हमारे शुगर होती है, शुगर के आपको लेवल पता है कि अगर ये लेवल है तो ये बॉर्डर लाइन है, ये लेवल है तो बॉर्डर लाइन से थोड़ा ऊपर है, उसको ये वाला दवाई देनी है, अगर और ज्यादा है तो और दवाई देनी है. तो क्या इस मेंटल डिसऑर्डर में भी कोई केमिकल मेजरमेंट्स लेवल हैं जिसके बेसिस पे डॉक्टर डिसाइड कर सकते हैं कि मुझे जो दवाई देनी है वो कितने mg की देनी है, अभी वो हिट एंड ट्रायल से देते हैं? ये मेरा क्वेश्चन है।
ओके, थैंक यू। पॉल साहब, मैं आपकी बात से शुरू में पहले डिसएग्री करूंगा कि मेडिकेशन का 5% का रोल है। ये चीज हमें समझनी है, क्योंकि जब तक हम इस मिथ को नहीं तोड़ेंगे हम अपने पेशेंट का नुकसान करेंगे। मेडिकेशन का बहुत बड़ा रोल है, और मैंने खुद कहा, एक्नॉलेज कर रहा हूँ कि केयर गिवर का भी बहुत बड़ा रोल है। अगर हम दोनों का रोल देखें, आई वुड पुट इट, मेडिकेशन is 70% and caregiver role is 30%. I will explain you why I am saying so. अगर मेडिकेशन पेशेंट को ठीक से मिलती है तो उसके सिम्टम कंट्रोल होते हैं, तब वो केयर गिवर के साथ भी उसका तालमेल बैठता है। अगर मेडिकेशन से हम मेडिकेशन नहीं देते हैं, सिम्टम नहीं कंट्रोल करते हैं, तो केयर गिवर के साथ भी तालमेल नहीं बैठता, आपस में टसल चलती है। तो मेडिकेशन को हम इग्नोर नहीं कर सकते। दूसरा, आपने कहा कि हिट एंड ट्रायल से चलता है, कोई केमिकल लेवल्स मेजरमेंट है या नहीं है। हमें ये समझना है कि आज की डेट पे ऐसा कोई भी केमिकल मेजरमेंट हम नहीं कर पा रहे हैं जिससे कि हम डेफिनेटली कह सकें कि इस पेशेंट को इस दवाई से फायदा होगा। ऑल्दो इस एरिया में रिसर्च चल रही है, हो सकता है आने वाले टाइम में हमें शायद कुछ आइडिया हो जाए कि क्या दवाइयाँ किस पेशेंट को सूट करेंगी, किस पेशेंट को सूट नहीं करेंगे, इससे फायदा होगा नहीं होगा। आज की डेट पे हम इस लेवल पे नहीं है, लेकिन आज की डेट पे हम किस लेवल पे चलते हैं, हम एज ए क्लिनिशियन, केयर गिवर्स जिस तरह से हमें रिपोर्ट करते हैं, पेशेंट से जो हमारी बातचीत होती है, उसके बेसिस पे सिम्टम्स की सीवियरिटी को हम रेट करते हैं और हम डिसाइड करते हैं। एज ए डॉक्टर जब हम दवाइयाँ चूज करते हैं, हमारा, जैसे कि मोस्ट ऑफ द, जो मैंने कहा कि सिजोफ्रेनिया को ट्रीट करने के लिए जो दवाइयाँ हैं उनकी एफिकेसी में बहुत ज्यादा अंतर नहीं है। तो हमें एक लेवल पे ये देखना पड़ता है किस पेशेंट को किस दवाई से कम साइड इफेक्ट होंगे, या जो साइड इफेक्ट प्रोफाइल है दवाई का वो किस पेशेंट को किस तरह से सूट करेगा, उस बेसिस पे दवाई चलती है। लेकिन अगर पेशेंट 2 ट्रायल्स को रिस्पॉन्ड नहीं करता है तो क्लोजअप स्टार्ट करने में लेट नहीं करना चाहिए, क्योंकि चाहे साइड इफेक्ट ज्यादा है लेकिन वो दवाई दूसरी दवाइयों के बेटर में मुकाबले में ज्यादा एफिकेशियस है। सो मेरी यही रिक्वेस्ट है, किसी को भी मैं ये नहीं कहूंगा कि मेडिकेशन का 5% रोल है, मेडिकेशन का बहुत बड़ा रोल है और हमें उसे कंसिडर करना चाहिए। थैंक यू।
जरा मैं थोड़ा और ऐड करता हूँ इसमें। देवराज जी, ये बहुत अनचैरिटेबल रिमार्क है आपका कि 5% जो है सिर्फ मेडिसिन का रोल है, 95% केयर गिवर का। मैं खुद एक केयर गिवर हूँ, और जो है अपना प्रोफेसर ग्रोवर ने जो है 70-30 किया, तो मैं उसको 50-50 करूँगा कि मेडिसिन तो बहुत इम्पोर्टेंट है, और जब तक मेडिसिन लेने से सिम्टम्स जो हैं वो कम होते हैं, और जब कम होते हैं तभी पेशेंट रिसेप्टिव होता है, और जो आपकी जो है थेरेपी भी तभी असर करती है अगर सिम्टम्स कम हो जाए। और दूसरा जो एक आपको समझ लेना चाहिए कि इसके लिए अभी तक कोई क्योर नहीं है, सिर्फ रिमिशन आप कर सकते हैं, उसको मैनेज कर सकते हैं, ट्रीट कर सकते हैं, लेकिन क्योर शब्द जो है आप वो ना ही यूज करें तो अच्छा है। ये लाइफ लॉन्ग प्रॉब्लम है। केयर गिवर्स का बहुत इंपॉर्टेंट रोल है, इंडिया में खासतौर से बहुत रोल इसका अच्छा है। और आईपीएस के एक प्रेसिडेंट थे, उन्होंने एक स्पीच में कहा था कि इंडिया में जो है इंफ्रास्ट्रक्चर अच्छा नहीं है कंपेयर टू नॉर्थ अमेरिकन कंट्रीज और वेस्टर्न यूरोपियन कंट्रीज, लेकिन फिर भी रिकवरी इज बेटर इन इंडिया कंपेयर टू दोज एडवांस कंट्रीज, क्योंकि यहाँ केयर गिवर्स है। सो दैट इज द इम्पोर्टेंट रोल ऑफ केयर गिवर, जो कि प्रोफेसर ग्रोवर ने भी एम्फसाइज किया है अपने प्रेजेंटेशन में। तो दोनों ही बहुत इम्पोर्टेंट है, केयर गिवर्स का रोल कम नहीं है, और मेडिसिन तो आपको देनी होगी। और दूसरा जो है, कई लोग बोलते हैं कि वो आयुर्वेदिक करो, होम्योपैथिक करो, उसके साइड इफेक्ट्स नहीं है, ये है वो है। और अभी ये जो है आयुर मिनिस्ट्री का चल पड़ा है, तो उसमें भी उन्होंने बहुत कुछ उसको भी एम्फसाइज करते हैं। और हमारा मेंटल केयर हेल्थ बिल जब था तो उसमें ये होम्योपैथी आयुर्वेदिक वगैरह कुछ नहीं था। तो जब 2016 में फिर से पार्लियामेंट ने इसको डिस्कस किया तो उसमें ये सब चीजें ऐड कर दी गई, क्योंकि आयुर मिनिस्ट्री का बहुत उसमें जो है इंसिस्टेंस था कि आप इसको भी ऐड करो। तो कोई 130-140 अमेंडमेंट करने पड़ गए उसकी वजह से। तो मैं तो ये कहता हूँ, जो भी हमारे फेलो केयर गिवर्स हैं, कि भाई आपको अगर कुछ आयुर्वेदिक करनी है तो करो, लेकिन जो एंटी साइकोटिक्स है उसको कभी मत छोड़ना। और इतना भयंकर परिणाम होता है अगर आप खुद डॉक्टर बन जाए और खुद आप मेडिसिन बंद कर दें। और सिर्फ आपके सिम्टम्स कम हुए इसका मतलब ये नहीं है कि आप मेडिसिन बंद कर देंगे। बहुत सी फैमिलीज में, केयर गिवर्स में इतने अभी तो सिम्टम खत्म हो गए ना, तो अब दवाई की क्या जरूरत है। तो ये प्रोफेसर ग्रोवर ने भी एम्फोसाइज किया है, भगवान के वास्ते खुद डॉक्टर मत बनिए, साइकेट्रिस्ट को पूछिए, आपकी कोई राय है तो साइकेट्रिस्ट से डिस्कस कीजिए कि भाई अभी इसकी जो है सिम्टम्स खत्म हो गए हैं, कैन वी रिड्यूस द डोसेज, और इसको बहुत ही स्लोली इसको कम करना चाहिए, अचानक आप बंद नहीं कर सकते हैं। और मैंने तो अभी कहीं डिस्कशन में पढ़ा था, देखा था कि क्लोजापिन को खत्म बंद करने के लिए 1 साल तक लोग पीते हैं, इतना स्लोली उसको बंद किया जाता है। तो इसका बहुत, इस वक्त सिर्फ जो है एंटीसाइकोटिक्स ही हैं जो कि वैलिडेटेड है, और जो आपका FDA है वो जो है 5 साल लेता है इसको जो है अपना ट्रायल्स करने के लिए, 7-8 साल बाद जो है इसका अप्रूवल मिलता है। तो बहुत ही इस पर जो है हाई स्टैंडर्ड्स हैं इसके, उसके बाद अप्रूवल मिलता है। और अभी जो मेडिसिन अवेलेबल है, आप उन मेडिसिन का यूज कीजिए, वो ठीक है। डॉक्टर जो है वो कई मेडिसिन देते हैं, कई डॉक्टर्स 2-2 पेज की प्रिस्क्रिप्शन भी लिख के देते हैं, वो परम्यूटेशन कॉम्बिनेशन करते हैं और इसको कॉकटेल बोला जाता है कि भाई हाँ ये दवाई असर नहीं करेगी तो ये कर देगी, ये नहीं करेगी तो वो कर देगी। तो उसमें आई एग्री के मेडिसिन इतनी ज्यादा नहीं देनी चाहिए। कई साइकियाट्रिस्ट जो हैं वो 1, 2, 3 से ज्यादा नहीं देते हैं, शुरुआत 1 से ही करते हैं। तो मैं समझता हूँ कि ये बड़ी इम्पोर्टेंट है केयर गिवर्स को समझना कि मेडिसिन के अलावा कोई दूसरा चारा नहीं है। और आप साइकियाट्रिस्ट को ब्लेम मत कीजिए, एक साइकियाट्रिस्ट की दवा से फायदा नहीं होता, 1 साल 2 साल ट्रीटमेंट चालू है, कोई वो मेडिसिन भी चेंज नहीं कर सकते हैं, देन यू कैन गो टू अनदर साइकियाट्रिस्ट। वो साइकियाट्रिस्ट की शॉपिंग तो केयर गिवर सब करते हैं, लेकिन कम से कम 1 आध साल एक साइकियाट्रिस्ट को दीजिए, लेट देम ट्राई। अगर किसी का हाथ में गुण होता है तो वो आपके पेशेंट को फायदा हो गया, और ये कोई जरूरी नहीं है कि एक पेशेंट को फायदा हो गया है कोई मेडिसिन दूसरे पेशेंट को फायदा करेगी। ईच केस इज डिफरेंट। कोई आप नहीं कह सकते कि भाई मेरे को क्लोज़ोपिन से फायदा हुआ था तो आप भी क्लोज़ोपिन दे सकते हैं, इट इज नॉट नेसेसरी। एक को फायदा होगा, दूसरों को फायदा नहीं होगा, किसी को ओलिंजापिन का फायदा होगा, किसी को कोई का फायदा होगा। और इम्पॉर्टेंट थिंग है, खुद डॉक्टर मत बनिए। और क्लोज़ोपिन तो जैसे डॉक्टर साहब ने बताया बहुत संभाल के लेनी है, और क्रोनिक केसेस में दैट इज द ओनली मेडिसिन व्हिच बेनिफिट्स यू। और लेकिन अगर तो उसका इलाज ये नहीं है कि आप क्लोज़ोपिन बंद कर दें, आप जो है वो एंटी सीजर मेडिसिन इंट्रोड्यूस कीजिए। अगर एकदम क्लोज़ोपिन बंद कर देंगे तो बहुत खतरनाक इसके कॉन्सिक्वेंसेस होते हैं, और जो कोई आपने प्रोग्रेस गेन किया है वो भी सब आपकी चली जाएगी। थैंक यू।
Thank you very much.
Thank you so much. Very sort of live discussion. Dr. Sandeep, I wanted to request you, since there are lots of questions, I know you have other engagements. Is it possible for you to stay on for another 10 minutes?
Sure.
Thank you so much. I am very grateful to both the speakers, and so therefore it's becoming a very lively discussion and lots of questions. I would request Ms. Kiran Joshi to go ahead with her question, please.
Hello, everyone. My question has already been asked. I'm the one who was talking about disability certificates and all. My point, I know the system very well. I've kind of read everything, Dr. Bakhshy, Amrit Bakhshy's, articles and everything. And I myself am a government servant, was a government servant, and therefore fully realize why government hospitals have been brought into the picture. However, it is okay. These rules are okay for physical disabilities. It is the same rule for almost everyone. These rules may be okay for patients with mental disorders of a different kind, mental disabilities of a different kind. But a schizophrenic patient is already very suspicious of what happens. Especially my son, who has a dual PhD, he is himself has been very brilliant, whatever, and so on and so forth. He's very intelligent and he's very quick to understand these things. His disease had become so bad that we had to use police help to admit him to a hospital, which was about 1.5 years ago, because there was no other way that he could be induced for taking medicines and so on and so forth. Now, the disability certificate, if it is issued only by the government hospitals, for some reasons, for some reason, one of his fears is any kind of disease, whether I have it or he has it or XYZ, a person on the street has it, disease and death. And therefore he avoids hospitals like anything. So now he was okay with getting the disability done as long as he was assured that it would be online. But the moment they asked him to come to the hospital, he himself picked up, researched everything. He says, 32, ye to inka psychiatric center hai. He's afraid that we are going to send him back to the hospital, put him there, or the stigma attached to mental illness and so on and so forth. Because as was discussed, he's lost his friend, he's lost everybody. His own father, from whom I separated several years ago, has also literally abandoned him without any money. So my concern is to assure that he has plenty of money to look after himself after I'm gone. We have everything else. I have support from the family, my nephews and nieces who will take care of him. I've got a flat that I bought specially for him next to my nephew's flat so that, he can be independent and at the same time kind of have some family support. But I worry about the adequacy of money, especially when it comes to any kind of disease, any other disease apart from schizophrenia, right? So I was trying to get him to become a dependent, declared as my dependent, so that he would be entitled to my family pension after I'm gone. And that also entitles him to lifelong medical care. But he refuses to go to the hospital, to a government hospital for this. He's okay with his own psychiatrist. He may go somewhere else, but he refuses to go to a psychiatric government hospital with all kinds of fears in his mind. So I am only questioning the provisions of this particular law or whatever it is called. Disability certificate, yes, but under the current law, all schizophrenics, or at least people like my son who are suspicious of people, everybody. And that's one of the, sort of problems with schizophrenic patients. He is not willing to go there, which means despite all these provisions having been made by the government, the schizophrenics are excluded from such benefits. And we are talking about inclusivity and all such things. So mere dimag mein to aa raha tha ki why can't some of us get together? Others may also have faced the same. So could we not somehow question this particular thing for schizophrenics? Because, there is no stigma attached to, for example, epilepsy, which is also mental, illness. But there is a lot of stigma attached to schizophrenia.
Okay.
So it is a very different kind of situation.
Thank you, madam. Thank you for your question.
Yeah.
I can answer that. May I request everybody to understand this, and I request without any prejudice.
Yeah.
I request everybody not to use the word schizophrenic.
Okay.
He is a person with schizophrenia.
Yeah.
He is a person with schizophrenia.
I agree.
He is not schizophrenic.
I'm sorry. And in fact,
I'm urging everybody to remember that.
I'm so glad that you pointed this out.
Please. Now, the issue which you have raised has to do things with at the government policy level. Now, what we need to let's understand this. I will come to the problem which you are facing. If you think that your patient, your son is comfortable with a particular psychiatrist, you can just talk to the psychiatrist and make him aware this is, and if they have a good therapeutic relationship, psychiatrist himself can guide and so-called facilitate his certification and other things at a government facility. So that's the solution which I am giving.
That is exactly what I'm trying to understand. Is it possible to facilitate this particular thing?
Yeah, the psychiatrist who is treating will have contact with his psychiatric fellow colleagues in the government hospital, and he can definitely facilitate.
Yes, I know, but I was told that my son would have to, because I talked to Dr. Preeti and all these people, and they said, "नहीं जी, यहाँ तो आना ही पड़ेगा उसको 3-4 बार."
नहीं, वही मैं मैडम यही कह रहा हूँ कि बच्चा अगर आने को तैयार नहीं है, जो साइकियाट्रिस्ट उनको ट्रीट कर रहे हैं वो उसको फैसिलिटेट कर सकते हैं, वो बच्चे को इस चीज के लिए तैयार कर सकते हैं. अगर आप नहीं कर पा रहे हैं, साइकियाट्रिस्ट को इन्फॉर्म करिए. डेफिनेटली वो
that we are trying now, because he is much better now and accepts that he has a disease.
जहाँ तक हम इंक्लूसिव एक्सक्लूसिव अप्रोच की बात कर रहे हैं, when we talk about this, we need to understand that there is always not a one straight jacket answer to everything. Exactly. If we talk about at this moment we are saying that patients of schizophrenia are not getting the disability benefit. I would say that the other way around, that if tomorrow government does something specific for patient of schizophrenia or patient with mental illness and everything, certification goes to everybody, any doctor can certify, it can also have its negative consequences that people will misuse. We know that in India, we have people who misuse this kind of thing. So we have to accept that government is making changes slowly, gradually things are evolving. Individual cases can be looked at how we can help the person. But I would say that the current provisions, at least earlier when you were only getting certificate from PGI or 32, now you can get from a civil hospital, any local hospital. That's a very big change, I would say that. So let's understand that. Yes, it may be difficult for some people, but that's the current situation. So we need to individualize and look at how best we can help the people.
और किरण मैडम मैं ऐड करता हूँ कि कहीं पर भी ये रूल्स में या लॉ ये नहीं कहता कि पेशेंट हैज टू गो टू द हॉस्पिटल, वो ये कहते हैं कि वो हॉस्पिटल इशू करेगा। अगर मैं पुणे में रहता हूँ तो जो पुणे के गवर्नमेंट हॉस्पिटल्स हैं वो सर्टिफिकेट इशू करेंगे। अगर आप चंडीगढ़ में रहती हैं तो चंडीगढ़, हाँ, तो लॉ और रूल्स अंडर द लॉ डू नॉट से दैट पेशेंट हैज टू गो देयर। लेकिन क्योंकि ये जो स्किज़ोफ्रेनिया है या मेंटल इलनेस है, इसमें जो है सब्जेक्टिविटी इज वेरी इंपॉर्टेंट। और आइडिया स्केल जो है, तो आइडिया, एक मिनट सुनिए, आप सुनिए, आइडिया स्केल में जो है कुछ वेटेज तो कितने लेंथ ऑफ इलनेस है तो उसका जो है वेटेज मिलता है। तो अगर उसकी 5 साल से ज्यादा की इलनेस है तो उसको फुल वेटेज मिल जाएगा। और बाकी जो है वो उनको सब्जेक्टिवली असेस करना होता है। और आपके जो है कब से इलनेस है, उसके जो प्रिस्क्रिप्शंस हैं वो देख के भी वो डिसाइड कर सकते हैं। एंड इट वेरीज फ्रॉम स्टेट टू स्टेट, फ्रॉम प्लेस टू प्लेस। किसी गुजरात वगैरह में जो है वो तो कैंप ऑर्गेनाइज करते हैं, विलेजेस में जाके वहां बोलते हैं भाई कोई मेंटली इल है, किसी को सर्टिफिकेट चाहिए तो हमारे पास आइए। वो अनाउंस कर देते हैं पहले कि उस दिन जो है साइकियाट्रिस्ट आ रहे हैं, एंड दे गो एंड गिव इट देयर। और सम स्टेट्स में जो है दे आर वेरी रिजिड, पुणे में दे आर वेरी रिजिड, बट इन सम स्टेट्स इट इज इजी टू गेट। ये जो है आपको यू शुड टेक इट with the government authorities, जो है डायरेक्टर मेंटल हेल्थ सर्विस से आप मिलिए, या जो आपका हॉस्पिटल है, गवर्नमेंट हॉस्पिटल है, उसके जो डायरेक्टर है उनसे मिलिए, उनसे कहिए कि ये प्रॉब्लम है। आई एम श्योर यू कैन परsuade them to be helpful। तो प्रोफेसर ग्रोवर ने बोला है आपका जो साइकियाट्रिस्ट है वो उनसे बोल सकता है अगर उनका रेको है। Or as a very special circumstances, they can come home and see the condition.
Yeah, but so, I think
ways out can be found.
Yeah, so
as I'm telling you, it varies from state to state. You see, they have to be satisfied, और उनका एक board होता है। ये one doctor doesn't decide, ये 3 लोगों का board है, they decide it.
ठीक है, okay, thank you so much for your help.
Thank you so much. Sonam Singla ji, we have 4-5 more people waiting. So can I request to be very brief in your questions? Sonam Singla next.
हाँ जी सर, मेरा क्वेश्चन ग्रोवर सर से है।
हाँ जी पूछिए मैडम।
बोलिए
सर, क्या स्किज़ोफ्रेनिया में बॉडी स्टिफ हो जाती है? क्या बॉडी की स्टिफनेस होती है स्किज़ोफ्रेनिया में, या कोई मेडिसिन का ही साइड इफेक्ट होते हैं?
देखिए, जो बॉडी स्टिफनेस होती है पेशेंट ऑफ सिजोफ्रेनिया में, एक आपने कहा कि मेडिसिन के साइड इफेक्ट की वजह से हो सकती है, या एक सेट ऑफ सिम्टम्स होते हैं जिसको हम कैटाटोनिया कहते हैं, उसकी वजह से भी बॉडी स्टिफ हो सकती है।
तो मेडिसिन आपसे ही चल रही है, आपके वहाँ से ही चल रही है, तो ये सुल्पिटेक और इलाशोट ले रही है, तो क्या उसका साइड इफेक्ट है या कैसे है?
बेटर तो है जब हम पेशेंट को देखेंगे, उनकी पूरी लाइफ हिस्ट्री रिव्यू करेंगे, अभी क्या सिम्टम्स है स्टिफनेस के अलावा, उसके बेसिस पे ही कह सकता हूं मैं। अभी बिना पेशेंट को देख के, बिना पूरी हिस्ट्री रिव्यू के मेरे लिए कहना अनुचित होगा।
मतलब कि बाकी अदरवाइज कोई सिम्टम्स नहीं है, नॉर्मल है, नॉर्मल चल रहा है।
हो सकता है कि साइड इफेक्ट हो सकता है, मैं मना नहीं कर रहा, तो एक बार दोबारा हम देखेंगे साइड इफेक्ट्स हैं या और कोई कैटाटोनिया, मैंने कहा एक सिम्टम भी हो सकता है, तो उसका ट्रीटमेंट डिफरेंट हो सकता है, तो हम देख के फैसला करेंगे।
नहीं, जैसे मतलब कि मॉर्निंग में सही है तो पूरा दिन वो स्टिफ रहते हैं, फिर नेक्स्ट डे बिल्कुल सही हो जाते हैं, ऐसा भी होता है कुछ?
हो सकता है, हो सकता है।
अच्छा, मेरी रिक्वेस्ट है सारों से कि यू नो, सिंस दिस इज अ पब्लिक सेशन, we should ask questions which are relevant for several people, you know, so around disability certification, mental health insurance, something that affects a large number of people. Individual consultation or individual questions, please talk to the psychiatrist in person. But because this is a public event, I would request the people who are waiting, if you have a particular question about a drug or a particular side effect, you could rather ask that in private. Right now, let's limit the questions which affect everyone generally. So I would, that's a request to everyone. Who wants to go next? Dr. Simmi, do you have anything?
Can I ask?
Yes, please go ahead.
Yeah. See, about what I joined late because I have to go to the doctor. See, what after us? ये क्वेश्चन तो सबको है. Secondly, जो long term assisted homes है, they're from Mumbai, Maharashtra. We see that the psychiatry, we really is very complicated, but still, यहाँ पे कोई assisted home या ऐसे नहीं है महाराष्ट्र में. I heard about Bangalore, they have. And मैंने बैंगलोर में भी मेरे बेटे के लिए ट्रीटमेंट लिया था निमांस में. And I got so in that case, अगर वो पीरियोडिक रिलैप्स हो रहा है उसका, तो और क्या कर सकते हैं, वही बहुत डिफिकल्ट हो गया क्योंकि वो बाहर आता है फिर कुछ ऐसी गलती करता है, मे बी इट्स अ पर्सनालिटी डिसऑर्डर, कुछ भी है. पूरा डायग्नोसिस भी उसका पूरा नहीं हुआ था. जो लास्ट डायग्नोसिस हुआ था वो तो क्लोजापिन बंद करके भी उसका चल रहा था. सो लॉन्ग टर्म के लिए अगर रखना है और रिहैब या किसी में, सो महाराष्ट्र में मैं बख्शी सर से भी मिलूंगा पुणे में जाके अभी. डेफिनेटली आई टेक हिज गाइडेंस.
आप मेरे को फोन कर सकते हैं. हाँ. और बेंगलोर में जो है असिस्टेड होम फैसिलिटी तो अभी नहीं है. सपोर्टेड अकोमोडेशन के लिए जो है वो, हाँ, निर्मला उसके लिए कोशिश कर रही है, तो वो शायद वहाँ हो जाएगा. और महाराष्ट्र में जो है अभी जैसे कि हम वो भी सब्जेक्ट था डिस्कस करने के लिए आपका रिहेबिलिटेशन वाला. और देखिए जो पेशेंट जो हैं जिनके अपने घर हैं, फैमिलीज हैं सपोर्ट करने के लिए, तो वंस द रिकवरी इज अचीव्ड और रिमिशन हो गया है तो वो अपने घर में जा सकते हैं, अपने फैमिली के साथ रह सकते हैं. प्रॉब्लम जो आती है गवर्नमेंट हॉस्पिटल से जो है पेशेंट रिकवर्ड हो गए हैं लेकिन वो फिर भी हॉस्पिटल में रहते हैं क्योंकि कहाँ जाए वो उसका कुछ ठिकाना नहीं है. तो अभी सुप्रीम कोर्ट ने भी ऐसा ऑर्डर दिया है कि द रिकवर्ड पेशेंट शुड बी रिमूव्ड फ्रॉम द हॉस्पिटल एंड दे शुड बी सेटल्ड समवेयर एल्स, और नए पेशेंट वहाँ एडमिट हो सकें. और हमारा जो एक्ट है, एक्ट में भी इसका प्रोविजन किया हुआ है. तो अभी 3 टाइप के पेशेंट्स हैं जो कि हॉस्पिटल्स में अभी तक पड़े हुए हैं. कुछ केसेस में जो है फैमिलीज उनको एक्सेप्ट नहीं करती, कुछ केसेस में फैमिलीज के एड्रेस ही मालूम नहीं है, उन्होंने झूठे एड्रेस दे दिए थे. कुछ केसेस में है पेशेंट नहीं जाना चाहते, वो कहते हैं कि हमारे साथ बहुत बुरा बिहेव किया था फैमिली मेंबर्स ने जब हम कोई इलनेस स्टार्ट हुई थी. कुछ केसेस में उनके एड्रेस मालूम ही नहीं है, दे हैव फॉरगॉटन के वो कहाँ रहते थे, क्या करते थे. तो ये 3 टाइप के पेशेंट्स हैं जिनके लिए कि ये एकोमोडेशन की जरूरत है. हाफ वे होम्स चाहिए, सपोर्टेड एकोमोडेशन चाहिए, कम्युनिटी एकोमोडेशन चाहिए. गवर्नमेंट ने इस बारे में कुछ नहीं किया, ऑल्दो दे आर ऑब्लाइज्ड टू प्रोवाइड सच फैसिलिटीज. तो अभी उसमें जो है एनजीओ वगैरह को कुछ काम करना है और उसके लिए काम शुरू किया है. एक बनियन ऑर्गेनाइजेशन है चेन्नई में, उन्होंने इसमें बहुत काम कर रहे हैं और आपके महाराष्ट्र में भी कर रहे हैं. जो थाना हॉस्पिटल से जो पेशेंट्स रिकवर हो गए हैं तो उनको कहाँ शिफ्ट किया जाए. महाराष्ट्र गवर्नमेंट ने पहले उनको लेप्रेसी होम जो है, जो कि अभी लेप्रेसी नहीं रही, तो ऐसे ही अपना अबैंडन्ड लेप्रेसी होम से वहाँ उनको डाल दिया. तो बहुत क्रिटिसिज्म हुआ उसका और कोर्ट ने ऑर्डर किया कि उनको प्रॉपरली आप रिहेबिलिटेट कीजिए. और कुछ पेशेंट्स जो थे जिनको वहाँ डाला उनको जो है फिर रिलैप्स हो गया और उनको वापस हॉस्पिटल में लेना पड़ा. तो फिर उन्होंने वहां से हटा के उनको बेगर्स होम में डाल दिया है. तो दैट इज ऑल्सो नॉट ए सोल्यूशन। तो ये जो बनियन है, इन्होंने थाने में प्रोजेक्ट शुरू किया है, आप थाने के हैं, और रत्नागिरी में भी शुरू किया है। तो उन्होंने क्या किया है कि कुछ हाउसेस जो है रेंट पे ले लिए हैं, तो जो थाने से रिकवर्ड है उनका 5-5 का ग्रुप बना के उनको वहां रखा है और उनसे कहा कि आप फैमिली की तरह रहिए। कुछ डोनर्स ने उसके लिए फंड्स दिए हैं, सो किराया उनको दिया जाता है, उनको प्रोविजंस दिए जाते हैं, और दे लिव लाइक ए फैमिली हेल्पिंग ईच अदर, और उनको जो वेरियस स्किल्स सिखाई जाती हैं। तो व्हेन दे लर्न दो स्किल्स देन दे कैन फाइंड जॉब्स इन द कम्युनिटी, और फिर उसमें नए पेशेंट्स, रिकवर्ड पेशेंट्स एडमिट किए जा सकते हैं। दैट इज रनिंग क्वाइट सक्सेसफुली। और उधर आशादीप ने जो है बनियन के साथ कोऑर्डिनेट करके असम में भी इस तरह के जो है होम्स बनाए हैं, और पूना में हम भी अपना बनियन के साथ मिलके ऐसे होम्स शुरू करने जा रहे हैं। सो उसमें काम हो रहा है, लेकिन प्राइवेट एनजीओ काम कर रहे हैं। जो आपकी गवर्नमेंट है वो अनफॉर्चुनेटली कुछ नहीं कर रही। महाराष्ट्र के तो एकदम थर्ड क्लास है, उनका कुछ भी नहीं काम हो रहा है, और दैट इज द कंडीशन। लेकिन प्राइवेट एनजीओ दे आर वर्किंग ऑन दिस।
Thank you. Thank you.
Thank you so much, Dr. Grover and Amrit ji. It is really very enlightening discussion that we all had today. Schizophrenia is so vast, and it has so many different kinds of symptoms. Some people can remain all right with, just hardly any medication, sometimes even just 5 to 10 milligram of aripiprazole, and others may need clozapine but still may not be completely all right. So it's a it has very diverse symptoms, alag-alag symptoms hote hain, alag-alag problems hoti hain. So aur iske I think answers bhi abhi dheere dheere, jaise aapne kaha, NGOs involved hoke उन्हें रास्ता दिखाना है आगे जाके कि क्या कुछ halfway homes, assisted living facilities मांगनी, डिसेबिलिटी सर्टिफिकेट अभी जैसे बताया कि थोड़ा सिंपलर हो गया है, आगे जाके हो सकता है और भी चेंजेस हो। तो हम सब ने इसमें आई थिंक मिलके ये सब एफर्ट्स करते रहना है। एंड निम्हांस काफी इसके ऊपर करती भी है वेबिनार्स जो केयर गिवर्स के लिए होते हैं, व्हाट आफ्टर अस, लीगल ट्रस्ट बनाना, फाइनेंसेस हैंडल करना, केयर गिवर्स का केयर करना, इन सब पे कई बार उनके भी वेबिनार्स होते रहते हैं बिकॉज वो काफी बड़ा इंस्टीट्यूट है। तो I would like to thank the speakers, and Aditya, please take over now. Thank you so much.
I completely understand that there are still lots of questions remaining, but we have run out of time. Both our speakers have to attend to other engagements. So we apologize if we have been unable to take some questions. We would, if you could just leave the questions in the chat box. Gurpreet will also share the email address. We will try and answer those questions. Please also join our mailing list for future webinars. So apologies if questions could not have been answered, but thank you so much for your participation. Thank you so much for your questions. I thank Dr. Sandeep Grover for taking out the time. I thank Mr. Amrit Bakhshy. This has been a very educative discussion. We look forward to more such discussions. We look forward to hosting you again. On the screen, you will see the Citizens for Inclusive Living email address. We also have a Facebook group and the Pushpanjali Trust website and email address. Apologies if your question or concern wasn't addressed. If you leave us an email, we will try to find the answer and email back to you. And please write to us if you want to volunteer, if you want to collaborate, or if you want to be on our emailing list. Thank you so much, Dr. Sandeep. Thank you so much, Mr. Amrit Bakhshy. Very, very grateful. Thank you, Dr. Simmi, for moderating this. And thank you, Gurpreet and Anup and all the participants.
Thank you. Thank you, Aditya. Can I leave now?
Yes, sir. Please do. Thank you so much for staying beyond the time. Thank you so much.
Thank you.
अमृत बख्शी जी बहुत बहुत धन्यवाद। अगर ऑडियंस का कोई ऐसा क्वेश्चन है जो हम आंसर कर सकें, मैं या डॉक्टर सिमी? आई थिंक डॉक्टर सिमी also has to go. Dr. Simi, thank you so much for staying beyond the time. If there is something that you want us to answer right now, we will stay. Otherwise, please email us. The email is given on the sheet here. Please email us, and as soon as possible, we will try and get back to you. Thank you so much, Gurpreet, Anu, Manu, for helping us.
Excellent seminars, Aditya. Very well done. Very much needed for the awareness to one and all. Well done.
Thank you so much, Dr. Renu Gupta.
Aditya.
Dr. Renu Gupta has joined from Kuwait. She's a professor of radiology at the Kuwait University. Thank you so much for joining, and thank you for your encouraging words.
Thank you. Please do it. Please do it.
Aditya, one question I have. Can you, maybe very weird one, but can I ask you?
हाँ जी.
See, जैसे कि ये डिजिटल एडवांस जिसमें में आपको कौन सा होटल अच्छा है, उसकी रेटिंग वेटिंग सब मिलती, सही बात है, हर चीज की रेटिंग मिलती है हमको जब हम सर्च मारते हैं। तो ये मेंटल इलनेस के जो भी फैसिलिटेटर है, साइकियाट्रिस्ट है, साइकोथेरेपिस्ट है, रिहैब्स है, उनका कहीं भी उनका वेबसाइट होता है, लेकिन उनकी जो रेटिंग, उनका फीडबैक कहीं नहीं होता है। वो साइकियाट्रिस्ट का वो बहुत ही जरूरी है, क्योंकि मैं ये नहीं कह रहा हूँ कि उसके लिए नहीं, बट पीपल जस्ट विद माउथ टू माउथ और इससे जाते हैं। अभी उनका कर्मा होगा कि उनको जो एक्सपेक्टेड है वो नहीं होता है, लेकिन उसमें कभी कभी जिंदगियां भी निकल जाती है। तो उस मामले में अगर गवर्नमेंट अगर कोई इनिशिएटिव ले ले या कंपल्शन करे। हाँ, आप सुन रहे हैं ना सर? हेलो।
हाँ हाँ, हम सुन रहे हैं। एक्चुअली आप जो कह रहे हैं ना, बिल्कुल सही कह रहे हैं, पर इसमें क्या है कि साइकाइट्रिस्ट इंडिया में है ही बहुत कम। और जैसे आप दूसरे देशों में देखेंगे, दूसरे देशों में टीम होती है, तो साइको सोशल वर्कर होते हैं, साइकोलॉजिस्ट होते हैं। सो फॉर एग्जांपल, जैसे अगर ऑस्ट्रेलिया में कोई पेशेंट नहीं ठीक है, तो वो टीम उसको जाके असेस करेगी, फिर वो डॉक्टर को बताएंगे कि ये प्रॉब्लम्स हैं। तो यहाँ क्या होता है, कई बार पीजीआई में कितने अच्छे डॉक्टर्स हैं, है ना, आप वहां जाओ, पर कई बार वो डॉक्टर्स